So thanks everyone that's joined us so far. Welcome to the second Nutrition Graduates Journal Club. Really glad that you could all make it. Where's mine? There we go. Welcome to everyone. Just for the benefit of those who didn't attend last month, what you can expect from Nutrition Graduates Journal Club is that we're an interactive community, we'd like to think more so than other journal clubs. There's an endless support from our members. I think since last month, we've now got over 1.8 thousand members on our Instagram and Facebook pages, so that's really exciting. You can improve your skills, and it provides you with a platform to practice presenting to an audience so that you get some real world experience in a safe space where you're not being graded, but you still get valuable and constructive feedback from your peers. So the team, we've got Lucy Jade, she's the Nutrition Graduates founder and director. I'm Lily, I'm the Journal Club founder and coordinator. Amber is our newsletter manager and blog coordinator, and we've got Heather, who's our website specialist, and she also manages our CPD and jobs pages on the website. We also actually have some really exciting news for you guys. We will be launching this as well on our social media over the coming days. But we have now got a new sponsor, and they are, should have done a drum roll, but the Almond Board of California. So the Almond Board are dedicated to sustainable agricultural practices, food safety amongst almond growers. They've got the Almond Academy, which I encourage you to check out because it's really good. They've got some AFN endorsed CPD resources for nutritionists and dietitians. And once you've completed the courses, they'll send you the certification and things. So you can find that on www.almonds.co.uk. Our journal club sessions will be running once a month, but we'll run them in seasons. So we'll do 4 months on and 2 months off. The sessions will run for around an hour, but to be honest, that'll be quite dependent on audience participation. The papers will be released a month in advance. We've actually already got next month's paper ready and loaded for you, so we'll go over that at the end of today's session. You'll have opportunities to speak. We're now running these as meetings and not webinars. So instead of having to raise your hand and be invited to the panel to speak, when you want to say something, you can just unmute yourself and get involved. And we think that that's just a little bit more inclusive. For those people who don't make it, all the sessions will be recorded, and CPD certificates will be sent and emailed out within 48 hours of filling in the feedback forms. So everyone that's joined will be sent a feedback form. I think that's going out at 8 PM this evening. And then once that's been done, we can get you your CPD certificate. So like I said, if you've got something to share, just unmute yourself to talk. In the feedback, they said people were saying that it's quite handy just to be shown exactly what that looks like. So just in the left-hand corner of your screen, that you'll have a little button there that's mute. Without the red line through it, that means you can be heard. That means you're not muted. And then with the red line through it, that means you cannot be heard, so you're muted. Our club rules are just to be kind, keep all your feedback constructive, and be respectful. So if you're going to unmute yourself, try and pick a respectful time to do that, and just be conscious of the person that's talking and try and not sort of override them. But it's all kind of common social sense. And we're now going to go over to Lucy to have a word from her about challenges within nutrition research even. Sorry, Lucy. Thank you.
Thank you. So we wanted to add sort of a little bit of a different feel about this one. So we wanted to add sort of a little bit of an educational bit at the start, just to kind of get you thinking, and you can make notes, or these are just sort of the things that we've picked up. So just going to go over a couple of different challenges that can occur when you're looking into nutrition research. So, next slide, please.
Oh, sorry, of course.
We're going to do a bit of a Boris Johnson here. Next slide. So the first one that we come up with was compliance. So are all of the participants compliant to the advice that they have been given? So if you think about it in terms of research, a lot of nutrition research we would look at would be in relation to dietary advice. So, for example, eating a certain number of vegetables a day. How do we know that the research participants followed that every day? It's quite hard to make sure that they are 100% compliant with that. Then you've also got financial challenges. So who's funded the study? It's always helpful to look into where the funding of the study has come from. So sometimes companies will be a bit cheeky and fund research in order to help them with their products and make them look more beneficial and make their sort of their benefits look a lot better. So it's always helpful just to Google the funding source just to see where that has come from. And then you've got ethical challenges. So I suppose in terms of you can't risk malnutrition in participants such as children. So for example, somebody would not be able to ask a child to do intermittent fasting or to cut out certain food groups just in case of malnutrition. So they've got to think of the ethical sides of that. That's always a big thing that they would have to think of. And a lot of nutrition, I suppose, is advice based. We don't sort of say you have to do this, this, and this. It is all advice that we give out to people. So again, it's a bit like compliance, really. Have they managed to follow all of the advice given completely? If you've advised someone to do a certain amount of exercise every day, are they realistically going to be able to do that? Are they going to be doing it realistically if they carried it out every day? I mean, some of these longer studies can span out across sort of months and years. So had they managed to sort of keep that up and linking it back to the start with the compliance of that? Next slide, please. Then you've got recall bias. I know we've all sort of probably all looked at sort of 24-hour recall and food diaries and things. So recall in things like food choices can't always be accurate. They're not 100%, and things can be missed. So people can forget about, if they are sort of doing a food diary, they can forget about a little snack here, drinks here. It's totally easy to do. So is the method that they've collected the data on that, is it 100% accurate in terms of sort of their recall and their memory? It's sort of human error. It's totally normal to be able to forget things like that. So then you've got unconscious bias. So unconscious bias is sort of assuming something due to someone's gender or their age. And usually this is outside of your awareness or your control. So you don't realize that you are being biased towards people. So for example, say in jobs, younger people can be seen as less experienced and less reliable than older people or people that have been in the job a little bit longer. So it's just looking at where sort of the bias could possibly slip into that. If you are looking at, say, I mean, sort of male, female, there's bias there, obviously, and age and things like that. So just keeping that in mind as well. Then you've got publication bias. I suppose people that do research, it can take years to complete the research. So it's probably can be so tempting to only publish the results that back up the point that they're trying to make. And just to support the research topic that they've done. So make sure that you try and read over all of the data just to make sure that they've included everything, and just bear that in mind that that could happen. And then finally, you've got selection bias. So, for example, students, I know when I did it, when I did my dissertation, my research project, I thought, what's the easiest group I can get hold of? University students, they're right in front of me, they're right here. They will do it if I buy them a coffee. It's the easiest group to get hold of. So they're going to be likely to choose peers and recruit for study. So have a little look about who they are, where they study, where they work, and look at who the participants are. So the underlying rule, sort of, I suppose, when you're critiquing research, is to question as much as possible. There could be some bias there that's not necessarily obvious at a first glance. So having a little look and questioning as much as possible is always a good way to start. And finally, for me, I'm sure you've all seen the hierarchy of scientific evidence, but I just wanted to bring it back out and reiterate how important it can be. So at the top, obviously, we've got meta-analysis. So that's just a statistical analysis that combines the results of multiple different scientific studies. So really sort of beneficial one to look at. And then we go down to randomized control trials, which can be effective because the subjects are randomly assigned to a group receiving different interventions. So they're not sort of biased towards anything. So that's a really good group to look at. We then go down to cohort studies. So participants in a group that are in like a particular group, so such as a demographic, occupation, age. which can be a little bit more restrictive. And you've got your case control studies. So this is sort of a study that can help determine whether a certain exposure is linked to an outcome. So, for example, if we were looking at whether smoking causes lung cancer, that's your sort of case control. And then you've got your cross-sectional studies. So that's sort of more of an observational study that can analyse data, usually from a population, but it doesn't involve any manipulating variables, and usually sort of takes a snapshot at one point in time. So it doesn't really look at anything else around it or any other variables that could affect it. And then you've got your animal trials, your in vitro studies, and then the lowest being case reports, opinion papers, and letters, which are the types of evidence that we're least likely to use as a credible source. So bear this all in mind when you are looking into research, and especially when looking into the credibility of it. That's me done.
Fantastic. Thank you so much, Lucy. That was really, really helpful. I'm sure everyone was scribbling away there, making notes. Fantastic. Thank you very much. So we're going to go into this month's paper, which the topic was chosen on was gut health. The paper is a 2020 study by Valeriani et al. And the title was Are Nutrition and Physical Activity Associated with Gut Microbiota? So this is a pilot study on a sample of healthy young adults. So a pilot study just means that it's a preliminary study to try and find out whether it's worth doing any kind of future research. So the first thing that we wanted to kind of relate to the CPD template. So the first question that we'd want to ask is what to think about is what primary question do the authors attempt to answer? So I just thought I'd just give the audience a chance to see if anyone had come up with anything there. If anyone wants to unmute and raise a hand. No, that's all right, no problem. So we looked at this and thought that, so to what extent does nutrition, so it was a Mediterranean diet that was looked at in this study, physical activity, and that which was measured by METs per week, and BMI influence the prevalence of the gut microbiota, Firmicutes and Bacteroidetes in the gut microbiome. So there were 59 participants, 49.1% of which were male, so it was a nice even distribution gender-wise. They were all young adults with a mean age of 23.1 plus or minus 3.14 years, but they were actually all students as well from two separate universities in Italy, so you can kind of gather that they're going to have a relatively health conscious lifestyle anyway, so that's just something to think about. And they were all also 100% Caucasian, so there's going to be some generalizability issues there. For the methodology, they had their inclusion criteria was just for young adults and that they were enrolled at an Italian university. I think from looking at this, I don't know about anyone else, but it's quite clearly a dissertation piece of some description. But their exclusion criteria was quite robust. So it was anyone presenting with a chronic disease, anyone who was pregnant with a food intolerance, anyone with a GI infection, anyone using antibiotics, anyone that had a GI procedure within the last 3 months, and anyone who failed to provide a fecal sample, because that's what they were using to test for the gut microbiome. They used questionnaires. So it was a Mediterranean diet questionnaire by Martinez Gonzalez et al. 2004. So there's quite a lot of literature supporting the use of that one. And then for the physical activity, they used an IPAC questionnaire, and that's a robust and sort of internationally recognised standard of quantifying physical activity. For the fecal analysis, the students collected them at home, and then when they were brought into the labs, they conducted PCR tests on the samples. And the results showed that the Firmicutes versus the Bacteroidetes, sorry, it's really testing my pronunciations, these things, were at 61.6 and 30.7 respectively. So bacteroidetes showed the highest relative abundance, between them they showed the highest relative abundance found in fecal samples. They used Pearson's correlation coefficient to show significant negative correlation between physical activities and firmicutes, and the linear regression showed a significant decrease of firmicutes when physical activity was increased. So we also wanted to think about what the take-home message of the paper was. Does anyone want to raise a hand for this one?
Feel free to use the chat box as well if you're not quite sort of hot for.
Oh, absolutely.
You can use the chat box as well.
That's all right. We'll get people raising their hands eventually. We'll just need to do a few of these and people get more comfortable with it. It was quite a simple one. It was the findings provide evidence supporting the value of gut microbiota characterization. And Heather had a bit of has her own presentation that she was going to give to the group. So Heather, hi, would you like to?
Yeah, can you hear me all right?
Fab, it's lovely. I'll just move on to your first slide.
Cool. Yeah, so I've just basically broken down the sections I'm going to talk about tonight into areas from the CPD template. So I'm starting with authors and journal credibility. So obviously we've kind of talked about this already really, but researchers, they're from different departments within universities in Italy. And from having briefly looked at each author sort of individually, you know, all of them have been involved in other research, and they've worked on other papers. Some of them have worked on papers together. So to me, they all seem to be, you know, qualified to be talking about this particular subject. In terms of conflicts of interest, I couldn't see any obvious ones that were mentioned. But I did, however, have a question over the research used to assess the dietary habits, and I'll talk more about that in my next slide. The last point, was that I didn't really think the paper read well in some places. So, for example, if you read the first sentence of the abstract, it says, literature shows that gut microbiota composition is related with health. I don't know about anyone else, but, you know, I wasn't altogether sure the sentence read quite right. Now, of course, that might not be of any major sort of significance, but I did wonder if those kind of errors, if you want to call them, might be related to the journal's impact factor. Now, I'm not previously familiar with impact factor at all, but I just thought I could see if I could find out what the impact factor was for this journal. I know it's something we talked about in the session last month. Anyway, had a bit of a look around and found that this impact factor was 1.26, which according to the scale I believe is quite low. And then I had a look at why impact factor matters at all. Essentially, the higher the impact factor, the more highly ranked the journal. And the higher ranked journals will usually have, you know, higher standards for accepting manuscripts. So you can expect better scientific value and a better prepared manuscript. So I wondered if that might explain why the standard of the paper perhaps isn't the best. If we could just flip to the next slide, please. In terms of methodology, in terms of like the sample, we've sort of already spoken about this as well, but obviously they're students from degree courses that the researchers themselves are part of. I would have said that the sample was an opportunity sample, so a bit like Lucy was saying, they're using people that are available to them. I did wonder if, however, if there might be the possibility of volunteer bias. So the sample that they did get, you know, could have been biased because the participants were more highly motivated and they had more time on their hands. You know, they're people that enjoy doing questionnaires. As well as, sorry, let me rephrase that. In terms of the assessment of physical activity, you know, there's always the possibility that participants could exaggerate about how much exercise they actually do. Yeah, and then if you could just flip to the next slide, please. So then in terms of assessment of dietary habits, I mentioned I had a bit of a question over this. So basically, I had a look at the research or the research paper and found that it had actually received sponsorship from the University of Navarra. Now, of course, there might be nothing wrong with that, but I did find that the author, Martinez Gonzalez, is actually the chair of the Department of Medicine and Public Health for that university. So it just made me question, firstly, what else the researcher might stand to gain from having that sponsorship. And then from knowing that, how credible is that paper for use in other research? If we could just flick to the last slide, please. And then finally, just a bit about the discussion and inclusion. So this is not particularly insightful, but it's just what came to mind. So one of the things they've obviously done, I think they've done, is highlighted the need for further research, which is good. So in the introduction, they talk about how exercise can, determine changes in microbial composition, but that a lot of the available evidence for that is on studies in mice. And then if you flick to the discussion, they talk about how, there needs to be further investigation in order to explain what the effects of physical activity are on the human gut microbiota. And then another thing I think they've obviously done is acknowledge their limitations, the main one being obviously the sample size. And it seems to me that the small number of participants actually hindered some of the evaluation that they've tried to do. But, despite that, they seemed hopeful that, as the study goes on and there are more participants, they can explore those initial findings, or these initial findings rather, in a bit more depth. Yeah, that's me. Thanks for listening.
That's lovely. Thank you so much, Heather. That was fantastic, and we're really hoping that it's going to inspire some other people as well to take the plunge and actually, present something as well. So that was really, really inspiring. Thank you very much. So we're going to look a little bit more into the limitations of so strengths and limitations of sorry, hang on, what is it? What's it doing? There we go. We're going to look a little bit more into the strengths and limitations of the paper. And again, over to the audience, if anyone has any particular strengths or limitations that they'd like to discuss.
Hi, it's Sean here. Can you hear me okay?
Hi, yeah, welcome.
Thanks. I have to say, I think just Heather, after your presentation, I pretty much had everything noted down that you had. So I kind of agreed with all your points. Which makes me feel good. Picking up the same things as you, just in terms of the wording and I suppose the kind of maybe the scientific writing. I think when you see a paper published in a journal, you automatically assume, oh, it's been peer reviewed, it's published, therefore it should be good. And then when you were reading it, like you say, the kind of sentence in the abstract, and there was a few other bits I think instead of using external factors, they use the term outer factors and not participants and a few bits like that. It just kind of, I don't know, just kind of made me make a note. And then in terms of the strengths and limitations, like you said, with obviously the IPAC questionnaire, a bit like kind of the food recall, there is that tendency for people to exaggerate that they're doing perhaps more physical activity than they actually are. And I thought then maybe in the limitations, they might have kind of mentioned that. And I know obviously this is only a pilot study, but if the study was to be repeated, they could get maybe participants to wear pedometers or some kind of tracking device. Obviously there's a cost and kind of resource linked with that. Maybe if they just mentioned that in the limitations, you just kind of would then be like, oh yeah, they've acknowledged it and they know maybe, in further studies, it's something they can improve on.
Mm-hmm. Yeah, no, absolutely. I was nodding to myself because actually you saying what you've just said has reassured me that I was along the right lines. So no, I'm really pleased to hear what you said, actually.
Good. And it's a bit nerve-wracking, when you're kind of reading it and you have your own opinions, you're like, oh God, is everyone else thinking the same as me?
Mm-hmm.
That was my piece. That was everything. No, that was all I wanted to say, just that I agreed with you in the bits on the strengths and limitations.
That's amazing. Thank you so much for that. That's really, it's really, really nice to get you guys talking as well, and to hear that actually by sharing all of this, that you can put each other's minds at ease and know that you're on the right lines.
Yeah, definitely. And I think just because of the nature of the group, there's not, I know that you've kind of said that's the purpose of the journal club. I just feel a little bit more confident kind of voicing my opinion, when everyone's in the same boat almost.
Yeah, oh, that makes me so happy. Yeah, that's exactly what this group is supposed to do. So that I'm counting that as a huge win.
Oh, good.
Fantastic. Does anyone else have any strengths or limitations that they've picked up on that they'd like to share?
Hi, can you hear me?
Hi, Sarah.
Hi, how are you? Yeah, just so I agree with everything that Heather and Cheyenne said. As well, I think like they could maybe repeat the study in like a different racial group, because like they were all white, Caucasian, Italian. So like I don't know, they could maybe do it within another university, like in the States, where there's more of like racial diversity, maybe to kind of strengthen their points. Like, yeah, that's kind of one of the things that I thought maybe that they could.
No, I think that's a really important point. Actually, there's not much generalizability in the within the population at all. So it makes it quite oh, what's the word I'm looking for? It's quite restrictive.
Yeah.
In terms of its applications.
Yeah, like it's understandable like that they had like the group of students within the university, but like I don't know, I think if you wanted like to back up the point, you would have to repeat it in like different racial groups. Like I think yeah.
Fantastic. Anyone else? Come on, we've got a few people in. Take the plunge.
Hi, sorry, it's me again. If no one else is going to jump in, I might just say one thing. I suppose the nature of the study, obviously it's students and they have to bring in like a fecal sample. Like, I don't know whether you class it as like a limitation, but probably a lot of people will be self-conscious about kind of the study protocol and the methods. And I know obviously to do the testing, you have to do it on the fecal sample, but I don't know whether it's a limitation as such, but that might be why they kind of had quite a high dropout.
Absolutely, I couldn't agree more. It's not the most I suppose it's probably not the most dignified of tasks to be involved in, is it?
So, and I know you have to do that to get the results, but it's just that's perhaps why they had a high dropout, and then obviously they didn't have enough numbers for the data to be significant then.
Well, they did mention in the study that they'd had a particular, in their own limitations, they've highlighted that they had a particularly high dropout.
Yeah, exactly.
I think they had like two separate days that they could have brought in their samples. I think if they missed that, then they missed it completely, sort of thing. So I think it was a combination of people not being able to get there on time or not being able to make those days, and yeah, definitely the not feeling comfortable with the procedure. Okay, thanks very much. Does anyone else want to come up before I move on? No worries. So I'd looked through and thought of some strengths for the paper. So it's quite it's a homogeneous group. It can be a strength. It's also a limitation because you can't generalize it across all populations, but it does mean that it provides quite a solid reflection of what it might be for one particular group. The authors chose appropriate statistical tests with the student t-test and the chi-squared, which is appropriate for looking at a single independent variable for linear regression. And I've mentioned a bit more about the inclusion and exclusion criteria in it, but there's quite sound inclusion and, well, actually, to be fair, it was quite minimal inclusion criteria, but the exclusion criteria is quite scientifically sound. So in terms of limitations, obviously it was a really low participation number, and then the adherence after that was bad as well. And because of that, they were unable to evaluate possible differences in gut microbiota composition among the subgroups defined by BMI category. And that's because it was such a small sample, they had only a couple of people were overweight, and they had no one that was obese. So they physically didn't have that within their sample to draw an analysis from. They were also, for the same reason, unable to analyse the composition of the microbiome at a genus or species level. So, because the Bacteroidetes and the Firmicutes is a kind of umbrella term for sort of lots of, is an umbrella term, so it meant that they weren't able to look into it in the complexity that they wanted to. And they had their ability was hindered to make comparisons among physical activity levels. Sorry, my notes page is just frozen on here. There we go, because there's quite a few limitations. They also had contrasting results to Lambert, which they do mention in the study. But if you actually look at it, the study that they've compared it to, they've done it on rodents that were all obese and diabetic. So I'm not sure how. I'm sure any connection that they've made to that has got to be pretty loose. So I'm not sure why they would have used that. I don't feel like all of their references were totally appropriate, and that might indicate a little bit of bias, that they were literally just sort of finding any way they could to support their original hypothesis. Also, fecal samples are not a true representation of what's going on in the gut. That's just what the gut's capable of getting rid of, and I think most nutritionists will be aware of that. And so in order to take a true representation, then they'd need to actually have a sample from the stomach, and that would need to be done over a few different periods of time, if that makes sense. So it just seems that their resources were quite limited, so they've kind of done the best they can with what they had. And then, of course, we've spoken about earlier, it can't be generalised across other ethnic groups, children, teens or older people, because it's such a select sample size. So we have a special guest with us. It's Dr. Tom Lewis. He's an honorary nutrition graduate member. Tom is a hospital doctor. He's also my boyfriend, but he's also really, really good at stats. And so to save me tripping over my own words, because I'm still very much, I'm trying to do all these courses and stuff to get myself back up to scratch with the stats. Tom's got a few slides on this paper that I think are just fantastic and will really be beneficial for everyone. So, hi, Tom.
Hi there, can you all hear me? Yeah, all good. So, I've just got the exciting job of trying to get down into the statistics of this paper and try and break down whether they use the right test and whether that's applicable and whether it's sort of, going ahead a few slides here. And yeah, just whether they chose essentially whether they chose the right test and kind of what it shows, and a bit of an explanation into help you guys sort of look at future papers and try to look at the tests that they've used and whether you think that's applicable to that, what they've described. So if we can have the first slide, please. So first we're going to have a look at the statistical analysis of the demographics of the group. So they used predominantly chi-squared and student t-tests, and they both look at the sort of same, they're looking for the same answers in that do essentially the two sets of data that you're comparing fall under a natural distribution, which is the sort of bell-shaped curves that we'll see. And the main difference really between them is that a student t-test is more of a quantitative data, so it's essentially where you've got something that's measured in numbers. So in this example, we've got the two groups of the participants and non-participants, and age is the obvious one that's a bit of a linear thing. So you've got obviously 0 to however old they are, and looking at the sort of p-values as the sort of percentage that this is a repeatable or this is a by chance test. So that where it says 0.91, that suggests that if you were to do this test 100 times, 90% of the times your groups of participants would not have a similar age distribution to what we've got in this study, and that's kind of repeatable along. Trying to figure out, it's a bit small on my screen to see which ones it was in the end. So it's just really A is the only one they've used for that, really. And then in comparison, we've got a sort of chi-squared test, which looks at two categorical groups of data. So in terms of participants and non-participants being one category, we've then, for example, got the BMI category, which is the underweight, and whether they're sort of comparable, and again with a normal weight. So you've got four actually across that distribution. And yeah, they are all sort of appropriately run. The one bit that didn't quite fit, and I think the text hasn't quite met the arrows, but the categories for the Mediterranean diet score and the sort of physical activity scores weren't really shown in this graph, but you can use a chi-squared test if it was otherwise just a score of 1 to 9 on the Mediterranean diet score. You could use a student t-test, and it might actually be more applicable in that one, in my opinion, but it's not set in stone necessarily. Interestingly, the one that might be repeatable, they've said, is the BMI, or the one that's sort of closest to having a p-value that's significant, at 0.13 at the side is the BMI categories. Again, I'm not sure entirely why that is, probably because they've got a fairly significant group in the middle and sort of that lower groups at the either side of it. Whether that's a normal distribution of the population or not, it can't really be said, maybe in Italy, or particularly amongst Italian young students. And yeah, but it's still not classed as statistically significant because it's not below that 0.05, which just means that if you run that, it's got 5% chance of those results being due to chance. Okay, if you have the next slide, please. So in terms of the sort of Pearson's correlation coefficient, which is what they use to show the relation between the bacteria they found in the fecal samples and their independent variables being the sort of the BMI of the participants, the physical activity, and the diet score. It only really shows whether the data that is collected, whether that falls within a sort of normal correlation, whether those results are if you could predict them independently, sort of thing. So, but it doesn't actually give you a sort of a strength of how equal they can be compared. So if you look at the little graphs on the right side of your screen, you can get an R value between 1 and -1, and essentially the closer it is to 1, whether it's a positive or negative, is sort of a strong correlation, and the lower numbers, so the 0 right at the bottom there, you can see that if you were to plot the two parts of the data against the graph, and it's a bit more clear on the next slide where I've got the one in the graph from the study. They're just completely random. There's no correlation there whatsoever. And yeah, just so to explain the R value, so it's a negative value, you've got a negative correlation like that middle graph, and a positive correlation is obviously the positive number. And in terms of generally how things are considered, if it's less than 0.3, it's a fairly weak correlation, as you can see by that middle one, and sort of 0.7 above up to 1, you've got a fairly strong correlation. So you can see all the dots are sort of meeting around the sort of that sort of distribution line. And that's a linear regression, and that's kind of what you have to do to add on to a correlation graph to show that there's actually a predictability about it. So a correlation coefficient is assuming that both of the sets of data are completely independent of each other and one has no effect on the other, essentially. Other key things you need to make sure that the data, there's no significant outliers in that, and you can only really see that when it's plotted on a graph. And then again, there is a linear distribution rather than saying your data appearing as a curve or wider at one end compared to the other. And that's kind of apparent in this next slide, if we can have that up, please. Sorry, we've got the numbers for the correlations first. So this is what they found in their results. As you can see, so the R values is where we've got the correlations, and as you can see, they're all fairly small numbers, all fairly close to 0. Particularly the ratio of firmicutes and bacterialities, and the METs per week in their physical activity, right at the bottom right there is 0.01. So that there's essentially, if that was to be plotted on a graph, it would be absolutely no correlation whatsoever between those. And the only one that has a significant p-value is that one at the top right there, the sort of abundance of firmicutes compared to the exercise they do, and it's a negative correlation. It is fairly weak correlation, which I don't think they really highlight it. They just say it's statistically significant, which it is, but actually there's not a strong correlation between those two. If you have the final slide, I think that kind of explains best why. So when they did a linear regression model, to be honest, I don't know too much about the ins and outs if you're going to perform these tests. It's more for how you interpret them in a paper, but that's looking at essentially, say, if you've got a correlation between data set A and B, in this case our Firmicutes and our exercise, could we then, if we were to plot that on a graph, predict if the independent variable, the exercise, would then be able to predict the abundance of Firmicutes in the fecal samples? And on that graph here, so underneath it, sorry, it just says where the R squared value equals 0.07. So again, that's as a percentage. In this graph, it's only 7%. So that's essentially saying that if you were to take 100 participants and they were each to give you their physical exercise in that score, you'd only be able to predict the Firmicutes abundance in 7% of their stools. So that's really actually quite a low linear regression score. So it's not actually that significant, even though from their small sample, it's right. It's not statistically, well, it's statistically significant, but it isn't actually that strong correlation. Now, to make stats even harder, sort of linear regressions are expected to sort of fall along a normal distribution. And looking at this graph, I don't know if you agree with me necessarily, but I would say the distribution isn't that linear. There's a lot more data on the sort of lower end of the graph towards the sort of physical exercise, and actually the distribution along the y-axis, so the quantity of Firmicutes, is quite a lot wider, I'd say, than the other end. And that's what heteroscedasticity is, essentially. It just means that there's a big variance in one end compared to the other of the results. And actually, on that note, with these sort of types of results, they do often create a lower p-value, or it might be sort of essentially because you've got lots of more data in there, but actually the distribution at the extremes is usually quite narrow. So by running the sort of regression models, you get a lower p-value than what you'd otherwise expect. And this is probably due to the sample size, what Heather and Lily were both mentioning earlier, that this is obviously a weakness of the paper. And I think that's highlighted by this graph here. And also we've got circled the outliers at the other side. I think I would class those two specifically as significant outliers because they are quite far from the distribution curve, probably outside that 95% confidence interval. So really they should be removed to run a linear regression on this sort of data. And I wonder whether that would actually flatten the sort of correlation distribution between these data and make it actually less statistically significant. That's sort of my view on it, really. I think that's all I've got to say on that, on the stats of that.
Thank you so much, honestly, on behalf of everyone. Thank you, darling. Thank you. That's really, really helpful. I'm sure absolutely everyone will have found that really, really helpful. Thank you. Just back over to the audience then. Does anyone else have anything that they want to add to that fantastic bit of stats?
Just that it's helped me understand stats a bit better, I think. Thanks, Tom.
Fantastic. I'm glad it's helped. Okay, well, I feel like we've covered things quite comprehensively. You'll all get a chance to submit your feedback. I'm sending that. I've already got the email ready, and it's being sent out for 8 o'clock this evening. So any feedback that you want, that you feel like we can change this up, would be fine. Oh, there's something coming into the chat. Oh, no worries. Sarah's had to head off. That's fine. Right. So we do have some handy listening for you guys. Most people, I'm assuming, have Spotify now. So I just wanted to run through a few. Really, really handy podcasts. I know Lucy, actually, great minds think alike. She hadn't even seen this presentation yet. Lucy posted a fantastic Instagram about it the other day, but we've got the Kernels of Nutrition podcast that's actually run by Rosie, who works for the PR team in the for the Almond board, and I hadn't known this, so when I first spoke to her, I was fangirling a little bit. But anyway, it's a really handy podcast. It's quite, they're getting really good guests on. Nutrition is the first guest on there, I think. So that's really handy. But what you can do, if you've got Spotify there, you can just scan this code and it will be available on the recording afterwards. And that will just take you straight to the podcast. We've also got Abby Attenborough's podcast, the NutriTalk podcast. It's really good. She gets some fantastic guests in. I think she's on episode, I want to say something like 7 or 8 now, but I'm tuning in every week, and they're just really handy. We've got the Food Medic podcast with Dr. Hazel Wallace. I think everyone knows of this one already, but it's just a really handy one to have. She's got a really nice voice, if that makes sense, and I could just listen to her for ages. And sometimes when my eyes are a bit strained or I'm going for my walks, I think these are just really nice little extra resources to have. We've of course got Rhiannon Lambert. So I think most people are already following her already though. Nutrition Matters podcast is really nice. Paige is really thoughtful in the way she kind of approaches her nutrition topics, and I really like how she gives her guests time to speak and stuff, so that's really nice. Our next session is on Tuesday the 25th of May at 7 p.m. again, so we're just going to do it in the last Tuesday of every month. We think that's a little bit easier. From the feedback that we had from the last session, you guys are quite keen to look into some mental health stuff. So we have picked quite a cool paper actually. It's an article on the exercise and the prevention of depression, and it's a result of the Hunt cohort study. So this is a huge study. There's lots of participants. Nearly 34,000. And there's quite a lot of methodology to look at. There's quite a lot of but it's also quite different to the previous two that we've looked at. So like I said, that will be of sending you all the links and everything like that at 8 p.m. this evening. So that's all good. And that is everything from me. Does anyone else have anything that they'd like to say or anything?
I'll just pop in and say that was brilliant. I've learned a lot. I help run nutrition. I learn a lot in these sessions, and Tom, thank you so much for coming on and debunking all of those stats, because no way would I have been able to do that. I took so many notes during that, and I think I'm going to have to Google a lot of those words again just to make sure I understand them. But thank you.
You are brilliant, thank you. Really, honestly, just really appreciate it. And it's really nice to have everyone. It's nice that everyone pitches in, and I think if everyone's just a bit, if everyone's a bit honest and say, I genuinely don't get this, it'll actually relax you to find out that you're not the only one. Everyone sits there thinking, oh, everyone else knows it, and they just, Tom does. but I'm certainly no statistician, or I'm surprised I even managed to pronounce it. So. Fantastic. Right, well, I'll say thank you very much, everyone, and really hope to see you all next month. All right.
Thank you. Thanks, guys.
Thank you. Cheers.
Bye.
Thanks, bye.